And that's why I have come to tell everyone preoperatively swelling and numbness will last for 9 months.
Last week, you saw my 9-week post-op update after my Lapiplasty bunion surgery. And this week, I'm taking you along to my physical therapy session that happened right after that post-op visit. This is actually my 8th PT session. And during this appointment, my therapist is checking my progress compared to where I started during my initial evaluation. A lot of this session is very technical and focused on my specific measurements, my mobility, strength, and how my foot is improving. But if you're interested in seeing some of the actual exercises they had me do after the evaluation and what my recovery routine looks like at this stage, make sure you stay tuned. And as always, don't forget to like, comment, subscribe, and share with anyone who may be recovering from surgery or thinking about having one, who wants a real look at what the process can be like. I'm walking without my boot now, but my balance is still a work in progress. I'm relearning how to apply pressure through my foot again, so you may see me wobble or lose my balance at times. This is all part of retraining my foot and getting back to normal movement.
It's not too bad. She crosses over a little bit. Well, it's not awful. All right, come on back. So the last time I did this, I'm pretty confident in your ankle motion, but I just gotta double check. Go ahead, toes up. Good. Pain with that, come along here. Or no?
No.
Good. Go ahead, point down like a gas pedal. Go turn your foot in for me. So I'll almost try to get the sole of the foot facing the other way. There you go. Pain with that?
It's okay.
Okay, go ahead, turn out for me. Pinkies up almost, yeah. Try to turn, so relax for me.
I feel it there.
You're feeling it here?
I feel it right in here.
Okay, go ahead, relax. If I move it in this direction, anything there?
When you go all the way, I feel it there.
Okay.
Yeah, in same space.
Coming through here?
Yeah, right there.
Okay, go again this way. It's not that motion. Alright, I'm gonna measure. So, toes all the way up. No issues, no problems here, correct?
Yeah, it's okay.
So I got you +5. Last time we did this, you were -1. So all that means is perfect score is neutral. Not a perfect score, but at least we need neutral, right? You're in a nice 90 degrees.
Okay.
Anything below neutral, right, where your foot is a little bit more flexed down, right, is negative for us if we're measuring this motion, right? Because you need this motion when you go down the stairs. So last time you went from just a -1, which you were pretty close to neutral, to this time you're getting +5, you get neutral and then some, which is a good thing for me. All right. Go ahead, point down like a gas pedal. I got you with 75. Other side we was 82. Last time we measured this was 58. So again, improvement with it.
Okay, good.
And that's always the good thing. Go ahead, turn in so your sole's facing. No pain or discomfort with that, correct?
No, it's good.
30. Last time we measured that, it was 14. I have the other side as being 30, and so that's even symmetrical. All right, and then let's turn out for me. And this is the only one you get discomfort with, correct?
Yeah, but not there when I do it further to
Coming
the right.
along
Then
here.
I feel it. Yeah, when
And
I go
again,
like
it's
all the way to
all
overextend. Yeah, it's like
coming here.
right in here.
Yeah. 20. So last time I had you at 12, this time I have you as 20, the other side I have is 25. And again, that's the biggest one that you're getting discomfort in. So not bad, definitely normalizing closer to the other side. No one's gonna be perfectly symmetrical, but you should be relatively within ballpark. The biggest thing for me from an ankle motion is just that you're having that pain there.
Okay.
Right, which to me, again, is gonna be a little bit of post-tib. Right, post-tib is gonna run basically from your navicular about here, and it's going to run all the way down and behind, which is typically where you're getting a lot of your symptoms. So a lot of the times that is just because again,
I get it more like here, up in here is where
so
I feel it.
Not uncommon. It could go a little bit into ant-tib,
Okay.
right? But if you're getting anterior medial impingement, which is going to be all of this region,
That's where I feel
right?
it.
That can be a little bit because this is your ant-tib tendon. If you pull your toes up, This is your ant tib,
Mm-hmm.
right? So that could be pinching, and then your
What about like right in here?
coming here again is going to be where more post tib
Okay.
is going to be running, just because that'll come to attach up to here,
Yeah.
right? And again, though that one is always important because that's the one that helps control support of the arch, and when you're going down into a foot flat position, so when your foot's flat on the floor,
Mm-hmm.
it prevents the caving in. Some of it's going to be normal, right? I was like, people are flat-footed, that's fine, it doesn't usually cause things, but it's about how much you can control. So in terms of strength, does that have enough strength to help control this? So every time you're putting your foot down, you're not collapsing, because you have to remember, if you're also not pushing off all the way, right, something's going to have to overcompensate, so then you're going to more or less likely collapse more. Does that make sense? Let's see how we're doing here. All right, so lift that big toe up. I'll let you do it by yourself. Just that big toe for me, as much as you can. Good, relax it. Go again.
Seems like it's not moving much.
It's not too bad. Relax. Go ahead, curl that big toe. No, it's not too bad.
Yeah.
Go ahead, relax. All right. Go ahead, raise that big toe up as high as you can. Right about there.
Yep.
Go ahead, relax. That's going to be about 45. Last time we did this, you had 14.
So that's a big difference, right?
But you want a lot of toe extension. Typically, if I remember correctly, you want about 50 to 60. So again, ballpark
Yeah.
is where it needs to be, but the motion isn't quite what we want it to be.
Okay, because it was
Right.
15 before, then now 45, and it needs to be at 50 something?
50, 60 is about what we would want it to be. Again,
Okay.
depends on the surgery, depends on how well you're doing. But for you, I think it's a reasonable assumption. Doctor was happy with mobility, continues to want more, right? So it's progressing the way we want. It's just not where we want it yet. Does that
Okay.
make sense? All right, go ahead, push down, curl that toe as much as you can. Right about there. And it's gonna be 23. Last time we measured this, you were 10.
10, okay.
So again, better.
What should
This
it be?
one-
Because that one feels stuck
Yeah, I was like, this one, it's a little bit different. Typically around like 40, 45 is more of what I would be looking for.
so
So
I
not
still-
bad, still sticky, right? Again, motion at the ankle looks really good. Ballpark the where I'd wanted to. If nothing else changed with that, I wouldn't be upset,
Okay.
right? Here, better than what it was first day, but this is something from a mobility standpoint, still needs to work because it's still a little sticky. Given
Yeah.
the type of surgery you had, not uncommon. It's not going to come back right away, right? But the biggest thing is continue to motion, work on that, right? Whether that's you taking it and kind of taking out the ball of joint and helping it
Yeah.
in both directions, right? Or if that's you doing what we showed on the floor, where
Right.
you're just bending all the toes and you're putting over pressure with the body, right? Or you're over pressure with the body. Again, it's just going to be, it's not going to happen overnight. It's just going to be about going to tolerance with it, and then hopefully getting more and more and more. Again, better than what was the first day that I saw you. It's just not where it needs to be yet. Does that make sense?
Yeah. So this also needs to be at 45, 46 or something like that as well.
I was like, roughly they'll be about the same. Typically people get a little bit more extension than they do flexion, mainly because again, when we're pushing off on that foot, you have to get so much,
Yeah.
right? So we expect a little bit more with this way, which right now you're following that trend, right? But we still need some this way, just because
Yeah.
it helps to grip the ground.
Because when I compare it to my other toe goes like almost
All the
like
way
90
down.
degrees. Yeah.
I was like, again, extra, just because there's a normative range doesn't mean people don't have extra. Right?
But I
was
just want
like,
it to match my other toe.
but also given surgery,
Yeah.
right, we had a structural change that caused an instability, caused weakness. He gave you stability and change, right? We give a little mobility. Does that mean I expect you to be the iron toe stock straight for the rest of forever? No, right? But it does mean, am I expecting quite as much motion here? It's hard to say. Some people do, and I always, that's what I shoot for, right? Some people, so long as we're getting functional, we're getting comfortable, we're getting the walk back to what it needs to be, then I'm typically pretty happy. All right, so follow it up, hold that position, don't let me pull. So hold, and relax.
Ooh.
That's where you're getting the symptoms.
Yes.
Coming through
It's right in here. All this. All of that.
And that's
Yeah,
only
like,
a 2, or that
it's
gets to be more than a 2?
More than 2.
Okay, what is it out of 10?
Probably like a 5 or
No problem.
6 or something like that.
All right, push down for me. Push, 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 and push. That's actually not too bad. Any symptoms with that?
No, that one's okay.
Okay, turn it in for me. Don't let me pull. Hold,
Same area.
hold. So that's the post tib.
Okay.
Right, that's the one that I was talking about. And again, if this one isn't, you're not getting as much symptoms with it, but I can pull you, whereas this one, you're getting a lot of symptoms, but I can't pull you. So it's holding really well, right? Whereas this one,
it's painful.
This one you're getting symptomatic, not as symptomatic, but I'm also pulling you a lot closer, right? This one's a lot easier for me to pull. So if you're having weakness and insufficiency of that post-tib, someone's got to work harder. So is this working harder because it's stronger, and now you're just getting pain with it because it's overworking?
Okay.
Does that make sense? Yeah. So again, two-part thing, right? Because I think your ant-tib is strong. I'm not worried about that. You don't let me pull. It just hurts. Whereas this, it hurts, and I can pull you pretty easily. Does that make sense?
Yeah.
So this would just be a muscle that we want to continue to work on.
Okay.
Turn this way. Don't let me push. No pain with that. And so the reason you'll get pain when you come over here, when you move it, but you don't get pain when I push it, because these muscles are fine, which is what makes it work. But for this to go here, you have to stretch everything here. So if it doesn't want to be stretched and it doesn't want to contract and become symptomatic, it just kind of further corroborates the fact that between post-tib and tib-ant, right, you're just getting one that's overworked and one that's weak and not working efficiently. I'm going to push on it. Don't let me push. That's not too bad. Pain with it?
No.
Okay, try one more time. Lift up. Don't let me push. This gets tired. Alright, curl. Don't let me push. Good. Curl again. Don't let me push. It's not too bad. Pain with that?
No.
From a strength standpoint, again, not bad. We kind of talked about A, B, C, and D, right? From big toe, all the little muscles of the foot. You actually hold pretty well. More limited in motion, right? But within the motion that you do have, you hold pretty strong. I can still move it, right? I always could be a little bit better, but smaller muscles are going to be a little bit harder. Happy with it. Actually pretty happy with it a lot. Could it be better? Yes, right? But I would say bigger deficits coming here and here, just from a symptom standpoint.
So what are you measuring here?
Coming here, just trying to assess for swelling. You've never been too bad. I'm gonna slow this one off real quick. Okay. I'm gonna leave the sock on though. That shouldn't make too big of a difference. And I'm gonna switch this over real quick. Lift up this one again. Bad. Still a little bit. I expect that to a degree, right? But you're managing. Most of it's going to be right here that we're getting along met heads, and then when I'm getting in the figure 8, the big loop-de-loop, just because it takes into account met heads and then coming through here. So again, swelling's not bad.
Okay.
Icing standpoint.
Probably the most swelling is in the big toe. Yeah. Because if you look at this, the left toe to this toe,
a little bit girthier coming through here and then coming through here.
Here is so fat too compared to this other toe.
Other side. Yeah. But definitely not too bad. Just ice as needed, right? You're far enough from surgery that I'm not going to say ice all day, every day. Days you do more, days you notice more swelling. Still good through here?
Yeah.
So again, more muscle activation, right? If I can't do it when I move things and you're very minimal to none when I touch it and when I move it myself, because the muscles I'm using, I'm moving everything, right? To me, it's only becoming symptomatic when you activate the muscles. It's more of a muscle insufficiency weakness problem, right? Overload symptoms, because we're just not used to it. We don't have that capacity yet. Does that make sense?
So I'm overcompensating, basically.
Overcompensating, right? And for muscles that aren't ready for the load, right? So again, that's why I always emphasize, yes, I want you to exercise. Yes, I want you to do these things. Not if we're getting 10 out of 10, 8 out of 10 pain, right? Because then we're overloading too much to the point of the muscles are like, what is going on? I don't know how to function with this, right? You could do 30 reps of something, have awful form, it's not going to do you the good you want, versus doing 10 reps, having great form, right? That is going to be more beneficial than just slamming things over and over and over, thinking I'm doing it, so it's going to be beneficial.
And that's the truth. 60 now is I don't even know what's going on back in the street.
So let's go for 10 to start.
This exercise is called a single leg cone touch, and it's all about rebuilding my balance and stability. As you can see, I'm definitely wobbling, but that's exactly why we're doing it. This helps retrain my foot, strengthen my balance, and improve control after surgery.
But you're still gonna have that yellow band under. So you'll still have some.
How many do I do, please?
20.
20? Just one set?
Yes.
This next exercise is another balance-focused movement. I'm balancing on one leg while using my other foot behind me for a little extra support and stability. While maintaining that position, I'm passing a light weight from one hand to the other, which adds another challenge and forces my body to stay controlled. I'm also stepping on a resistance band to help make sure my front foot stays planted and I'm not shifting my weight too much. It may look simple, but these exercises are helping me rebuild stability, control, and confidence as I continue recovering from surgery and getting stronger on my foot. This is the last balance exercise of the session, and this one really challenged my stability and control. For this movement, I'm stepping up onto a 6 to 8 inch box with one foot, then bringing the other foot all the way through into a marching position and holding that position for about 2 to 3 seconds before slowly stepping back down and repeating the movement. I completed about 20 reps of this exercise, and the focus is really on control, not just getting through the movement. My therapist is working with me to rebuild my strength, coordination, and confidence in my foot as I continue transitioning back to normal movement. After surgery, it's not just about the healing of the bone and incisions, it's also about retraining my body to trust that foot again. Exercises like this help me improve my balance, stability, and the way I transfer weight through my foot. This is the final exercise of the day, and this one really focuses on control, balance, and strengthening my lower leg. For this movement, I place a ball between my heels, and the goal is to keep the ball from falling while I perform calf raises using the ballet bar for support. I do this exercise for about 1 minute, and it may look simple, but it requires a lot of focus and stability. I'm working on strengthening my calves, improving my balance, and retraining my foot to move with more control after surgery. These type of exercises are helping me build back the foundation I need to continue progressing in my recovery journey. I hope you found this helpful. Don't forget to like and share with someone who may benefit from this journey. Thanks for watching.